Dear Chairman, ladies and gentlemen, I've got the pleasure to talk on a really interesting topic to spare radiation on patients and examination staff. This novel technique is called SpotFluoro, and I will introduce you in this technique and the need of this or other techniques to economize radiation procedures. This is the small agenda. I got to have a small introduction. I talk on collimation and its current limitations. I got to go to SpotFluoro capabilities, and I will introduce in a small and preliminary clinical study, and will go to summarize up at the end. Electrophysiological procedures have become more and more complex, which often results in a significant prolongation of the fluoroscopy time during a procedure, and various dose-saving techniques have been developed over the years and belong to the standard configuration of interventional fluoroscopy systems nowadays. Collimation is the most often used technical application to save X-ray exposition to the patient and wire scattering to the lab staff. One technical definition of collimation or collimator. A collimator is a device that filters the stream of X-rays which are not traveling parallelly to the specified beam direction. Collimation, however, has also some limitations at this moment, incorporated, which limits its great dose-saving potential. Conventional collimation is always and only symmetric. The entrance dose in the non-shielded part of the object increases, and image quality may get degraded. Here's a picture which nicely shows what I said. The white cycle just here is the region of interest, and the first collimator is put inside the view. You see radiation here, 1.5 milligray per minute, and with collimator 1 it's increasing to 2.0. With collimation B it is increasing up to 2.9 milligray per minute. That's one of the limitations of conventional collimation. The main principles on the new technique SpotFluoro: it is an asymmetric virtual collimation. It is a novel adaptive automatic brightness control (ABC) control system that avoids dose increase regardless of the collimation applied. And the superimposition of the last image hold keeps anatomical and device-relevant reference information, which is really nice for procedures you see pictures afterwards. Asymmetric collimation allows to be focused on a region of interest and not to expose larger areas than necessary. And in this way, it reduces scatter radiation or scattering as smaller volume is exposed. This is the example. It's only dragging region of interest via mouse clicks. And you see this here. It's a matter of seconds. Only the region of interest is exposed, and the last image hold is superimposed over the collimator blades. Another example showing collimation in an angiographic pictures. You see the ruler behind is not changed, and you can nicely have your technical reference. And with changed angulation, for example, you keep your frame, and you can just drag and drop it to the other side to have the same collimation fields. And one of the advantages of this technique is there's no entrance dose increasing when we collimate. The entrance dose is quasi-constant regardless of collimation, but which means dose area products savings are proportional to the collimation, which means 60% of the area collimated means 60% lower dose area products. And as air camera does not take back scatter into account, we can expect a significant reduction of skin dose delivered to the patient as well due to the SpotFluoro collimation. Here's some clinical examples. This is an AV nodal reentry ablation. You have one catheter in the upper part of the region of interest. This is a His catheter, which borders the higher zone of interest. That's the ablation catheter itself and the coronary sinus catheter. And once again, if you play that, you see only this region of interest is exposed, and you keep anatomical and technical information from the catheters and catheter shafts. That's an example of the PVI, of a pulmonary venous isolation catheter manipulated in the left inferior pulmonary vein. Another picture shows you how to drag and drop regions of interest or collimations. Let's just focus on a preliminary clinical study where SpotFluoro in electrophysiological procedures have been applied, and main goals of this small study was the answer of the following questions. Is there any negative impact on the workflow by using this new technique? And is there a potential dose-saving effect as a direct consequence of applying this SpotFluoro technique? And we have some radiological comparators, which is total fluoro time, for example, total dose area product, and total effective dose. Clinical comparators have been used as procedure time, as an objective procedural comparator, but we also have efficacy and safety, and last but not least, image quality. This is the group of patients, a small number of patients, as I said. We had performed AV flutter ablation as a standard calvo-tricuspid isthmus ablation, an AVNRT ablation procedure, which is done via slow pathway ablation, and pulmonary vein isolation via this device, which is called PVAC catheter. We had comparable groups consisting on 5 in the atrial flutter group in each technique, AVNRT 8 in each group, and pulmonary vein isolation 11 standard procedural patients, and 12 where we have applied SpotFluoro. Let's now go to the results. There is no substantial difference in fluoro time in minutes in the AVNRT group, but even if not statistically significant different, there's a trend towards a decrease of total dose area products, which is even more significant in the effective dose in millisievert. In the atrial flutter group, there's also no change in the fluoro time, but significant difference in total dose area product and in an effective dose measured via millisievert. In the PVI group, the biggest group in our patient registry, we have again no difference in fluoro time, but we had a substantial decrease in the total dose area product and in the effective dose. Some clinical comparators, as the procedure time didn't change at all statistically in all groups we examined. And as a result, the efficacy of all procedures, PVI, slow pathway ablation, and calvo-tricuspid isthmus ablation, have been successfully performed, including a 20-minute safety time window to avoid immediate recurrences, regardless of the application of the radiation technique. And regarding safety, In our group of patients, 50 patients, no complication was observed. Let's conclude. SpotFluoro is an easy-to-use function that does not require additional time or effort to apply. It does not have any impact on the overall procedural duration, nor on the overall fluoroscopic time. Virtual collimation, SpotFluoro, of any region of interest anywhere in the image is possible at any time and can be applied easily. The collimated field or region of interest can easily be repositioned in real time by simply dragging the virtual collimation frame within the last image hold. Collimation determines dose savings in a truly linear way, e.g. reducing the irradiated area through a collimation by 50% equals a 50% lower dose area product. SpotFluoro does not cause any image quality degradation. It enables high-quality fluoroscopy with up to 70% less dose delivered to the patient and a considerable reduction of scattering hitting the operator and the staff. There's no impact, no negative impact on efficacy and safety in EP procedures. Thank you.